Welcome to page 36 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Male and female pelvises differ. Let's look at some of these differences. First, we have here, of course, the hip bone or the pelvic bone here. That's the right, so we're looking at it from the front. And that's on the male, and here's the female hip or pelvic bone. Of course, the sacrum. Sacrum here. And this final little bone here is called the coccyx. This little bone here is called the coccyx. And this is the female pelvis. The coccyx here. And let's go over the ways in which they differ. First, the subpubic angle. Sub meaning below. Pubic meaning the pubis, the pubic bone. Remember, here's your pubic bone right here. And this is the subpubic angle. Notice in women that the subpubic angle is greater. It's a broader, greater angle. The male pelvis, it is more acute. Also notice that the sacral curve, the sacral curvature here, back here, is greater in females, or the curve is more significant in females, where it's flatter in males. Also note that the pelvic outlet is greater in size in the female than it is in the male. This makes sense. Females have to give birth or are created, the pelvis is made so that a baby can fit through the pelvic outlet. Note the space, of course, between the ischial tuberosities here, which is greater, a greater distance in females than it is in males. Of course, that has to do with the greater subpubic angle. The distance between the ischial spines is also greater in females and lesser in males. And lastly, this distance here between the coccyx and the ischial spine. This distance is greater in females than it is in males. But how is the pelvis held together? Why doesn't it just fall apart? Well, it's held together by ligaments. Starting here with, at the front, this is an anterior view here, so we're looking at the front. Of course, the abdominal muscles have been taken out, and all your organs have been taken out. And we have the anterior sacroiliac ligament. Why is it called anterior? Well, it's on the front. And number two, it's called the sacroiliac ligament because it goes from the sacrum to the ilium. The anterior sacroiliac ligament. So it would be here on this side. Running along the spine, the anterior portion of the spine, or the front of the spine, is the anterior longitudinal ligament. This ligament here runs all the way up and down the front of the spine, the front of your vertebra, all the way up and down the spine, and it notably attaches to the sacrum down here. Of course, it resists forward movement or anterior displacement of these vertebrae and or the sacrum. Of course, what is the function of the anterior sacroiliac ligament is to resist a shearing force or any forward movement of the pelvis on the sacrum. Or for that matter, any forward movement of the sacrum on the pelvis. The way behind the sacrum here is the sacro-tuberous ligament. Why is it called the sacro-tuberous ligament? Because it extends from the sacrum to the ischial tuberosity, and you can't see it because the obturator foramen is obscuring it here, but it runs, there you go, from the sacrum all the way down to the ischial tuberosity, and here it is from behind, right here. The sacro-tuberous ligament. From the sacrum to the ischial tuberosity, and this is actually palpable. You can feel it underneath the gluteus maximus muscle, a taut ligament. Back to the anterior view. In the pelvic ring here is the sacrospinous ligament. Why do they call it the sacrospinous ligament? Because it extends from the sacrum to the ischial spine. The sacrospinous ligament. The sacrospinous ligament. Note in the hip joint itself, where the femur head and the acetabulum meets the pelvis, you see these ligaments here crossing the pubofemoral ligament and the iliofemoral ligament. Here's the iliofemoral ligament and the pubofemoral ligament. And they are named aptly because the iliofemoral ligament extends from the ilium down to, here's the ilium, of course, down to the femur, whereas the iliofemoral ligament runs from the pubofemoral ligament runs from the pubic bone into the femur. Here. Traversing the pubic symphysis joint here's the pubic symphysis joint. We have the superior pubic ligament attaching pubic bone to pubic bone, right to left, and the inferior pubic ligament. Now here, some very important ligaments, especially for therapists dealing with back pain. These are often curiously involved in back pain and stability, is the iliolumbar ligament from the ilium to the lumbar vertebrae. Lumbar are these vertebrae right here in the low back. And they're very important for stabilizing and connecting the lumbar spine to the pelvis. Here are the iliolumbar ligaments again from the back, the posterior view. This is L5, your fifth lumbar vertebra. This is L4, your fourth lumbar. And on the back view again, we have the posterior sacroiliac ligaments here from the sacrum to the ilium. The posterior sacroiliac ligaments. On the front in red, we had the anterior sacroiliac ligaments. And in the back, we have the posterior sacroiliac ligaments. And the ligaments extend and actually blends with the sacrotuberous ligament, as well as attaching in the lower part of the sacrum. Also note from the posterior view here, the ischiofemoral ligament from the ischium to the femur. So note that, first of all, note the twisting triangulated and overlapping patterns of the femoral ligaments, the ischiofemoral, the iliofemoral, the pubofemoral, and how they're sort of twisting and overlapping. And notice that each of the bones of the pelvis, the ilium, the ischium, and the pubis, the ischium and the pubic bone, all have a ligament that attaches to the femur. This concludes the instructions on page 36 of Anatomy Coloring Book. This is Dr. Stephen Harkins. Until next time.